The United Counseling Service of Bennington County held its annual legislative breakfast meeting with area legislators in Bennington on Monday, January 29th. With the state legislature just getting underway in Montpelier, both the staff and associates of UCS, as well as other workers within the social service community, gathered to hear from the legislators.
My name is Lorna Matern, and I'm the Executive Director at United Counseling Service. Welcome to our staff, clients, community partners, and board members. And of course, welcome to our legislative panel.
In a departure from previous years, legislators also heard from some of the UCS leaders and others working in the community service field on the realities they were facing and how some of the legislation regarding the delivery of social services in areas like early childhood education, substance abuse, counseling, and psychological supports was playing out. The salary and compensation issue was a recurring theme of the discussion as organizations like UCS vie with others to attract the best talent they can recruit.
Our biggest challenge is access to service and clinician turnover. We continue to experience problems with labor market competition, as they also refer to that, in comparison to state employees with similar credentials and responsibilities. We found that licensed clinicians earned salaries $18,000 less than state employees for similar.
Then it was the turn of the legislators to update the crowd on what was on their radar screens. While much of the emphasis was on social services, the lawmakers also noted budgetary constraints and a proposed budget submitted by Governor Phil Scott last week that called for at best a modest 2% increase in spending, not enough to allow for many bold new initiatives when other questions, like education spending and an expensive cleanup of Lake Champlain, were also on the docket.
And I certainly, as a member of the Finance Committee, we're dealing with it. One is what's happening at the federal level. Our attorneys and our economic support staff in the legislature and all of us are still grappling to understand what recent actions at the federal level and how they are impacting our state. And that is a serious issue and one that we're going to continue to grapple with.
I want to say a few words. As chair of the Senate Judiciary Committee for a couple of decades now, I think mental health, particularly, and the way Vermont deals with it, particularly since the floods that ended up closing the state hospital, are one of the most needed changes that have to take place this year. There's no higher priority to me than solving this crisis, and I'm talking about all stages of the system, from the state hospital itself down here to the local level.
I think it was really interesting for me to hear the piece about the impact of going to $14 on the population that you serve, and how that's made an improvement. I think you're very wise to keep looking at compression and we know what happens with that, and we have to too in our state house. But you put out there some really strong arguments about when you do this, that people's wages go up. And I don't think anybody in the State House thinks that you're going to come out in May and right at $15 an hour, immediately. It is over time, and how do you do it, and how do you make design that's something that works well.
With that, I serve on the Transportation Committee, so our biggest thing that would relate to UCS is public transit, and we want to make sure that the local providers are fully funded and they have the buses necessary to provide the trips to patients to attend their appointments and whatnot. So,
Appropriations Committee in the Senate and House have raised them to 14. So it's just wonderful news. But there are other people who are not getting that money, like child care workers. We pay our mechanics $50, $60 an hour to fix our cars, change a muffler. Why do we pay our child care workers who have our future in their hands, our little children? So that needs to be worked on as well. I worry very much about the 10 hours a week only for child care. I'm very delighted that we have those hours for the children, but we really need more of that. It's not enough time. And moving kids around, as was mentioned here today, is really not in the best interest of the kids.
And I think we really need to know from the ground level, and as we heard the stories that you all talked about today, we really need to know what the needs are, because we'll hear these, what I truly believe are underestimated figures of, okay, we need maybe a 30-bed unit. Well, what is the reality across the state of what those needs really are? I would possibly say from Bennington, we may need 30 beds just for the population we serve, not including all the folks, from around the state. So if we are doing seriously this 10-year plan, we truly need to know what it's going to look like, how we're going to do it, and how it's going to serve all Vermonters, not just or the northern section, and make it very, very challenging for the folks here, whether you're visiting someone in corrections who then has to have a 2.5 to 3 hour trip to, northern Vermont.
The opioid epidemic was another subject that came up.
One of the reasons why we are only able to provide services to 40 folks is because we have not enough funding to hire the number of staff that are necessary to be able to increase that to say the 100 people who we believe need it. We believe that we also need a methadone clinic in Bennington. Right now, folks are still going to Massachusetts or Brattleboro in order to get treatment. Actually, I was just talking to Beth Sawsville last Thursday, who has a real difficulty in getting folks that she works with methadone because they're not allowed, because of corrections restrictions, to go to Massachusetts. So they continue to have to go to Brattleboro. So it becomes a full-time job to be able to go through recovery if you're not having it in your own community. And so being able to fully recover and getting the treatment that you need, plus being able to get back to work, being able to see your kids, being able to do what we all do on a daily basis. A lot of folks aren't able to do that because they are traveling more than an hour a day, waiting for their treatment, getting it and coming back. It really literally is a full-time job. And so the necessity to have methadone in this community, so we have a variety of options for folks, is important as well. Paul, did you want to...
Lee Romano of Dorset, a board member of UCS, gave us his takeaway from the morning's breakfast meeting with the lawmakers.
I think the reality of funding and the uncertainties of where the federal funding is going to go is definitely something that is going to be a challenge moving forward. I think Dick's involvement in the judiciary and appropriations hopefully will make a difference in terms of the state's understanding of the importance of UCS and the mental health, the state of mental health in the state of Vermont. And I'm hopeful that that's going to make a difference. The reductions that in the budget that they're referring to are not going to help, but there's not much we can do except to continue to work hard, continue to provide the feedback that the state needs to understand what the real issues are here, and the opiate issue obviously is going to need ongoing support.
For the GNet TV News Project, I'm Andrew McKeever.